The Edo State Ministry of Health held an engagement and dissemination meeting to assess and strengthen comprehensive emergency obstetric and newborn care (CMONC) services across the state. The meeting brought together key health leaders and partners, including the Honorable Commissioner for Health, Executive Secretaries of the Hospital Management Agency, the Edo State Primary Healthcare Development Agency, Health Development Partners, and other relevant stakeholders. The goal of the exercise was to improve emergency care for mothers and newborns, especially in local government areas facing high rates of maternal and neonatal deaths. Participants reviewed health data, discussed progress, and explored better ways to expand access to life-saving care. The Honorable Commissioner for Health, Dr. Siri Adams Oshomole, said the state government is working to ensure better health outcomes for mothers and babies. He explained that the administration of Governor Monday Okpebholo is focused on reducing maternal and newborn mortality, especially in areas with the highest burden.
800 women die from preventable causes related to pregnancy and childbirth. An estimated 2.4 million newborns die in the first month of life every year, with the most deaths occurring in the first week. In alignment with the Nigerian health sector renewed WAP investment initiative and sector-wide approach SWAP launched by His Excellency President Bola Ahmed Tinubu, the Coordinating Minister of Health and Social Welfare has approved free cesarean delivery for indigent patients who deliver in some approved public and private health facilities across the country, Edo State inclusive. This is to ensure that no one dies because of inability to procure cesarean section.
The Permanent Secretary of the Ministry, Dr. Stanley Ehimiya, noted that the dissemination meeting would help improve understanding of the current situation, guide data-driven decisions, and provide a roadmap for strengthening services across health facilities.
The goal of this dissemination exercise is to strengthen comprehensive emergency obstetric and newborn care (CMONC), the services, through evidence-based interventions. Specifically, we aim to share comprehensive results from the recent CMONC Bill of Quantity Assessment, highlight gaps and opportunities that exist in service delivery, and facilitate robust discussions that will lead to actionable strategies, policy reforms, and sustainable resource mobilization.
The State Coordinator for CMONC, Dr. Isovian Edward, gave an overview of the health facility assessment. He explained that the assessment was conducted to identify gaps in service delivery, staff availability, equipment, and infrastructure. The aim is to improve readiness and ensure that health centers are better prepared to handle emergencies involving pregnant women and newborns.
For every 100,000 live deaths in Nigeria, there are 520 deaths. What this means is that for every 100,000 women that go through childbirth in Nigeria, 512 died from the management of pregnancy and its complication.
Also speaking at the event, the technical leader for maternal and newborn health, family planning and reproductive health, Dr. Jayeola Oyetunji, representative National Health Insurance, Dr. Theodore Ehanire, representative National SWAP Coordinator Omoriyi Iyahen, emphasized the importance of strengthening healthcare systems, training health workers, and providing essential supplies to reduce preventable deaths during childbirth.
And I'm glad to tell you that the National Health Insurance Authority is at the forefront of this CMONC program. And in Edo State, the program has started fully in some selected facilities. And as of today, I can tell you, over 20 CMONC patients have been treated.
The SWAP Coordination Office does not intend to allow the state to go all through this alone. We are strongly behind you, and we do not see it as Edo State's problem. It is our problem. It's a national problem which must be tackled.
The high point of the meeting was the official unveiling of the Edo State Comprehensive Emergency Obstetrics and Newborn Care Report, which presents key findings and recommendations for improving services across the state. Irene Ejoba reporting.